Good morning. Today we are going to discuss a very important topic for both males and females, colon cancer screening. Current guidelines recommend beginning your screening at the age of 50 with either a fecal test, sigmoidoscopy, or colonoscopy. These are three completely different procedures and they vary in how invasive they are. Fecal testing is the least invasive. You will be given a kit to take home and collect samples from your stool. After collecting the samples, you will mail them to the laboratory indicated. If you choose this option, it should be done every year or every 3 years, depending on the type of kit you receive. With the sigmoidoscopy, the physician will use a scope to physically look and examine the furthest end of your intestine to detect any abnormalities. You do not need to be sedated for this procedure, and there's no bowel preparation. If the results are normal, then this can be done every 5 years. With a colonoscopy, the physician will use a scope to go further into your intestine to visualize a greater area. For this procedure, you will need to drink a special liquid solution that will help prepare your bowel. You will also need to be sedated. A colonoscopy has a few advantages over the other procedures. The first is that it is one of the most accurate tests we have at finding cancer. If there are precancerous changes in the bowel, we have the greatest chance of finding it with a colonoscopy. The second advantage is that if there are any abnormal findings, like a polyp, they can be removed right there during the procedure. And lastly, if results are normal, then you can wait another 10 years before getting it done again. But what is most important is your personal preference. Whether you choose the fecal testing, sigmoidoscopy, or colonoscopy, the main goal is that you get screened regularly. And if all of your test results have been normal, then you can stop screening at age 75. I want to end this video by saying that the guidelines we just discussed are for people with an average risk of colon cancer. Things that may put you at a higher risk are if you have a family history of colon cancer, a personal history of polyps, or a personal history of inflammatory bowel disease such as Crohn's disease or ulcerative colitis. Be sure to discuss these with your healthcare provider because it may mean that you need to get screening tests done more often.